Hi everyone. So I hope you're all doing fine, and I hope you're all, now back to the, normalcy in your mind, at least after the chaos that happened in the last 2 3 days. I hope you are all back to the idea that although the landscape in the exams, landscape for a medical doctor is totally changing with the introduction of next, but I hope now you've absorbed the change. And I know that as educators, me and almost all our teachers, everybody is trying their best to tell you what are the changes, what is the new thing, how the exam will be conducted, when the date, what will be the date, what will be the frequency. I've there are so many videos of my own self on the YouTube in the last 3 days where I've talked about what are the changes, what is the frequency of the next exam, and how the entire idea of a licentiate exam is introduced into the medical education in India. But today my agenda is different. Today I'm here to actually talk about the mindset required to handle any change that happens in your MBBS curriculum, for definitely, but also in life in general. And I'm here to talk about the change as your elder brother, as somebody who has seen a little bit more life than you. I'm not going to give you the granularity of the changes today. I'm not going to talk about what are the changes. There are so many videos already on the change. I am here to talk about the general principles of navigating change. And I believe these are some things which are so important, yet not many people talk about it. Change is something which is actually happening all around us all the time. Sometimes the changes happen in a shorter duration of time, sometimes they happen over a longer duration of time. For example, we had a COVID pandemic, and the entire way of how we are delivering our lectures evolved very, very fast. We were doing face to face classes in the COVID. We introduced India's first live classes on the app with eMedicoz. So it was a very fast change that happened. Or sometimes the changes are happening at a slower pace, so we don't notice them in our own lives also. The changes are not only restricted to the exam or the world, they are also related to people. I'm sure you will appreciate that people also change. Sometimes you meet somebody who was your friend in school, now you meet, you don't even connect to each other because you're no longer the same person any longer. Change is going to happen, and not only how what we are doing in life, how the exams are going to be conducted, how the people are going to react to us, what is the how the relationship would evolve, also technology. Today we are talking to you on a YouTube video. Earlier we would have talked to you by going to different cities, physically traveling. It would all evolve. And the once upon a time, you may not remember, there was Orkut, today then Facebook, then everybody shifted to Instagram. Things will keep changing, and I want you to take a deep breath and absorb. This is not the final change that you're seeing in your life. The things will change. For example, now in medical education, they've introduced a common final year MBBS exam, MCQ based, called as Next, which would not only replace your final MBBS, it would also replace your NEET PG exam, it will replace foreign medical graduate screening exam, and probably in future even the government jobs may be taken up through the Next Part 1 score. So landslide changes happen. But if you think as an individual that okay, this is the final change that has ever happened, we might be mistaken. I am here to tell you that when I look at things, it looks like that now this is one step towards standardization of education by having a common exam. So they might later on introduce a common exam for MD exit also. Like it happens in America. Like in America, wherever you study, at the end of your radiology residency, you write an American Board of Radiology exam. So we might have a common Indian Board of Radiology, Indian Board of Medicine exam in the future, and you might have a common MD exit exam. Who knows? So why am I here is I want you to know that changes are happening all around us. Not only now, they've been happening in the past, they will keep happening in the future. So what are the people who are successful are doing? People who are doing well in life are adapting to the changes fast. That's rule number one. Number two is people who are doing well in life are comfortable with the word change. They are not bound by the status quo. They are comfortable with the word change. I'll explain to you. I'll give you a few small examples from my life, not only the recent past, and if I go into my school days. When I was in my class 10th and I took biology to appear for the medical entrance exam, and I started studying the physics, chemistry, botany, zoology according to the syllabus prescribed. At that time in our zoology, they were asking rabbit and different animals were being asked in our zoology. While when I was in my class 11th, the NCRT, they changed the full syllabus of the CBSE exam, and they said now the exam will not be based on the older method. Now we will have a NCRT books based exam, which will have a more human focus on the biology. Suddenly, a landslide change happened in the syllabus. But whenever the syllabus changes, we believe that everybody will be looking at the change and everybody will be trying to adapt. But in reality, what happened was, and I saw it with my own eyes, lot of my friends and seniors, they continued to believe that the exam will keep asking what they were asking in the past. I saw the syllabus and I started reading NCRT books. I thought, this is what is written in the syllabus, let me do it. And I thought everybody else must be doing the same. I gave my PMT exam, that is around a few decades back. I gave my PMT exam, and during the exam, I was very happy that I know the answers. I was wondering what book have I read here, how I am able to answer so many questions so fast. And I was thinking maybe the exam is very easy for everybody. I finished my paper half an hour early. I was able to do almost everything asked in the exam. Everything was from the NCRT book, and I was very happy with what I'm doing. But I thought everybody must be doing the same. And being an average student, I have no chance. I'm from an ordinary school, so I thought I have no chance. I came back home. A month later, the result came. I had a All India rank 4. And the result was declared in the night. We saw with the torchlight in the in the notice board. You had to go to the DU and see on the notice board, see the result. It was All India rank 4. And I came home, told my parents. Nobody believed. We did not celebrate because nobody had full faith on me that he would get a rank 4. We went back again and we saw it. And then I confirmed. This was lesson number 1 for me in life, is that although the change is happening, although it is obvious, not everybody will adapt at the same pace. Some people will take time. So today I am here to tell you the changes are happening, changes were happening, changes will keep happening in all fronts of your life. Technology, career, whatever you're doing, study. Now who knows, the medical science itself will evolve at, but some changes are happening slowly, so you don't notice them. Although the guidelines for your disease management, everything is changing. The books are evolving. You can't read the first edition of Harrison now, you have to read the current edition. Changes are always happening. Okay, so let's go further. So what I'm trying to say is, who responds to the change fastest is the key to success. Number 1. Yeah, I'll give you another example. It is again very important that many people, when they see the change, but they are doing some things with a previous mindset. For example, some of you might have studied something or the other and you are like, because I've done it, I need to stick to it. And the pattern of the exam is changing. You need to adapt, you need to move fast. But some of you might think, because it is not easy to change. In terms of management, sometimes there is a term that is used that is called as flogging a dead horse. Flogging the dead horse means that suppose you are using a resource which everybody knows is having a lot of unnecessary material. It is not like to the point for the exam. It is not up to the mark for the real exam. But because you have invested 1 or 2 years onto it, you tend to believe that it is this horse should be the one that I should make it work. But the horse is already dead and you keep flogging it, but the dead horse cannot move forward. This is called as flogging a dead horse. It is seen in many large organizations when they build some technology or they buy some machine. Suppose you buy a radiotherapy machine and then the machine becomes outdated. But you have invested a lot of money on that horse. So they keep flogging it, that maybe somehow we can make it work. Maybe we can somehow market it better and we can make it work. So the key word is speed. You need to adapt fast. So once you see the change, you need to adapt fast. Some people take time. Some people take time because we have a belief that, okay, this is not true. We are in a denial of the change. This happens every time in our normal human relationships also. How many times we have seen that, you might have noticed around, or you might have seen in the movies, you might have seen in the love stories, the couple is no longer, working out. But they keep believing that, it would someday magically come back to normal without their efforts. It doesn't happen. We need to put our own efforts. So We have understood first principle of adaptation is you have to respond to the change first. And you have to be the first mover, you have to be the fast mover. The second principle of adapting to the change is we need to remind ourselves of our original why. What do I mean by the original why? Now suppose you are pursuing a career, in between you are hit by a rough patch, the exam pattern changes, you get a supplementary, you get you're disqualified for an exam, many things can happen during your career. And I've met many students who failed in the first year and they lost their track, or so many things can go wrong in your career, it can happen. But whenever the changes are happening and whenever things are going wrong, if you have a strong original why, that why did I come so far? Like for example, right now many of you are confused that oh my god, the exam pattern is changing, what will I do now? But if you have a strong why that okay, I want to become a doctor, this is my why, so whatever is happening in the way is part of the journey, it is not what I'm truly seeking. So you know that you will negotiate what is happening, you will try to navigate through it because you have a strong why. It is known in the world that people who have a strong why in whatever they're doing, they use this original why as a compass which keeps showing them the direction. Even when the waters are stormy and moving and the waves are there, your ship is losing the track, it is going upside down, but you have a compass which constantly shows you this is the direction you need to move, this is the direction you need to move, because you know that you have a very strong original why. So let's go back and understand again. We need to accept that there will be changes will keep happening in our life. They were already happening, they will keep happening. We need to respond fast because we can't be the last one to respond, we can't be the laggards to respond. I'll give you another example from what we have all seen. There was a company called as Nokia. They were making mobile phones and everybody was buying Nokia mobile phones. I'm sure you have heard about Nokia. And once upon a time, people used to say that there could be no other phone that anybody would ever carry because the Nokia was the most trustworthy brand. And on the other hand, suddenly the smartphones came into the place. So the Nokia had to respond fast, they did not change fast, and they could not adapt to the changing landscape. Now, why am I talking about this landscape change so much today is because to the best of my knowledge as an educator in the last 20 odd years, I have never seen a bigger change in the medical education sector happening than I have seen today. And this change is not only for you, it is also for the medical colleges, it is also for the students who are studying abroad, it is also for the colleges that have been established abroad and in India, which are catering to the Indian medical graduates. Every one of them will have to make sure that the students are helped in this kind of change because it is in their interests as well. If the students don't pass, their college, their reputation would also go. This is an exam where after the exam, the government or the board will also give them a rating according to the percentage of students who are passing in this exam. So everybody will have to reconnect to their original why. Why did you start whatever you're doing? And can you keep continuing on that journey despite the changes that have happened? And also acknowledge that this is not the last change that is happening. The changes will keep happening in this in your career, in your life. This is like you have to take it for granted. Now I'll give you an example. Suppose you do everything right, suppose you keep doing everything right, who knows, in the next 5 years the exams might be created by artificial intelligence, not just computer based test. Who knows in the next 5 years what work you will be doing, what work your generative AI would be doing, we don't know. Things will keep changing, but if you have a strong why on what you want to do in your life, you will keep moving forward because you will adapt to the change. Second is that we always, whenever the changes happen, we need to realign our priorities. Realign means according to the changed landscape, what is it that you want to do number one right now? I'll give you an example, and I think this is very relevant for the medical students today. Today, in your exams, the exam board is saying the predominant subjects will be medicine, surgery, obs, gynae, ENT, ophtha, pediatrics. Written in your syllabus. It is there in your syllabus. 10% will be from the applied aspect of the basic sciences, and allied subjects will also be asked. I'll give you a little bit more analysis of it so that you are able to realign your priorities. Suppose you are right now in third year MBBS. In third year MBBS, I know many children, what they will do is they will start reading their anatomy, biochemistry, because they don't know anatomy, biochemistry, physiology. That is true. And they will start reading because they want to do from the page 1 to page end. All the good students I know of have this problem that they can only read from first page to last page. But now suddenly there is an exam which is going to test you for clinicals more. Now your priority number one should be, first you will finish like we do in our DAMS foundation course, and in our latest, now in July we are starting a new foundation course where we will first do the 6 subjects that are going to be asked in majority in the exam first. So in July 10th in DAMS we have already realigned the priority of the foundation course, and we are going to do your medicine, surgery, obs and gynae, ophtha, ENT, pediatrics first. This is going to be your first priority. After you're done with this, then the second priority should be you will do the clinical short subjects, because like subjects like radiology, you will find radiology in every one of the paper. Radiological images are there in every subject, so they will be part of every paper. Dermatology will be part of medicine. Psychiatry will be part of medicine. Orthopedics is there in your Bailey and Love as a chapter also. Anesthesia will also be a part of surgery. So what will happen is your second priority should be you should be good at your clinical short subjects. But you will not start with these short subjects. I see some people starting their next courses with a short subject, which I feel that they don't understand the realignment of the priority. Realignment of the priority means that we now need to put all our bets on what are the subjects written first in the paper. So that this is the reason why I aligned the NAMS foundation. Realignment is the key word, and that is my strength. I see the change as it is. I don't bias myself by what I am or what has been the past, what we were doing in the past. I don't bias myself. I always look at the change as it is and realign my priority. From July 10 we are going to do the foundation course with first these 6 subjects will be covered. Number 1. Second thing we have done is, because the exam pattern will be predominantly analytical clinical vignettes, today onwards we are starting a program called as Next Clinical Life, where every day or every week 3 days, because 2 days you are otherwise having classes also in your weekend. So in Monday to Wednesday we will be doing a 2-hour session where we'll take a subtopic of your subject and we'll do clinical vignettes and approach to clinical vignettes on that topic, so that when you are giving the exam you already have the edge, because we were discussing the analytical questions, clinical vignette questions which are there in your gazette. They have already mentioned that this is how the paper is going to be, but we will not go towards unusual things. Again, remember, if you are following me now on YouTube or Instagram, almost every day I come up with this post and say, bhai, unusual is not going to help you, because there is no sense in asking unusual diseases for a final year MBBS exam. There is no sense in asking unusual rare diseases for a licensing exam. It has to be more usual stuff. Usual things will be usually asked. Don't forget this mantra. This mantra will become even more true now. Many people are misreading it. Many people are saying because AIIMS is now going to make the paper, we should always look at the INI-CET papers. That is not true, totally correct. That's not totally correct. INI-CET is an exam which is only catering to central institute seats. So the examiners, they tend to ask some new updates, some hi-fi things, because they want only the top candidates to be able to do it. There is no qualifying marks in the INI-CET exam. Next is a totally different exam. An exam board will always take cognizance of the fact that it is a qualifying exam. It is a passing exam also. So don't run after unusual. I will reinforce this. So you realign your priorities. You will first do your larger clinical subjects, then the shorter clinical subjects, then the paraclinical subjects like pathology, where because hemat we only read in pathology. Infections you majorly read in micro and PSM. And the third is pharmacology, where you read the drug therapies. So then you have to go to the bridge. Bridges, paraclinicals are the bridge between the basic sciences and the clinical sciences. Then you will read the copy of your notes of anatomy, biochemistry, physiology. Suppose you have less time, which is mostly the case in any exam. I would do in the top priority, I will do the notes, the test, the question bank. I will try to do everything in them. Okay. Like for example, if you're a damn student, so you will attend the medicine class live, you will do the notes, you will try to make your own notes, you will try to look at what the notes are provided in the soft copy in the back to basics, you will try to do the DQB, you will try to do the test, class test, SWT-A, SWT-B. There are 3 tests of each subject in DAMS platform, and then you will also try to do the grand test in the next pattern that we've already initiated this month. But in the subjects like anatomy, biochemistry, physiology, you will try that, okay, at least I do the classes, attend the class, make the notes. At least this much is done. So that, because the question number is lower on that, but they will be the rank defining subjects. So I know that these subjects are important, they will help me in my rank definition, but I will not put them on my top of my priority list. So realignment of priority according to the changing landscape always helps. You always need to understand what has changed in the world and how do I place myself in the changing world. Radiology as a branch is an example of how radiology has realigned every time with technology. I'll give you an example. Earlier radiology in from 1900s was only about X-rays and the X-ray films and those silver films where we were making the images. In the 1980s, when the computers came into play, radiology married itself to computers to bring to you CT scan. You remember? And then when the metabolic isotopes came into play, radiology married itself to the metabolic isotopes to produce PET scan. And now with the AI coming into play, I totally believe that radiology will further add on the AI algorithms into radiology. And I totally believe the success of any branch, any field, any individual, any organization lies in realigning your priorities according to the changing landscape. Now, whenever you start, you always start with the low hanging fruits first. Now, whenever the change happens, you suddenly have a huge, load in front of you that you know what to do. You have to start somewhere. So you need to start with the easier things, like, okay, let's start attending the lectures. Maybe if there's a classroom center nearby, let's go and attend in the class, because that's an easy step to be taken. That's a low hanging fruit, and you target that first. Once you are done with little bit of work, then the fog around will clear, and you start seeing more clearer that, okay, this is what I need to do. I'll give you an example. That, for example, now suppose you're starting just now and you have no idea what to do. So you start with the low hanging fruit, that you start deciding, okay, what course do I need to join? What will be my mode of attending? Will I be doing it face to face? Will I be doing it on the app live? Can I do it face to face and sit in front of the teacher? Can I, you have to start tick mark what is it that I need to do, and also start planning that, okay, these are my weak areas, my strong areas. And once you do it, start attending something, so that when you move forward, what will happen is, some part, when you cover up, you start feeling more confidence. And you have to look at the bright side. The bright side is, suppose you do the exam well. I feel that most of the time the internship in India was a period of maximum stress. You had work, you had duties, you had everything happening around you, stress, shouting, and plus a competitive exam at the end of it. The most important bright side of next is, it is going to happen at the end of final year. And plus, you don't have an extra exam. They have removed the theory exam also, so you don't need to write any short note, any long question. We need to look at the bright side, because when we look at the bright side, it gives us optimism. It gives us optimism that, okay, let us work for it. Second thing is, if you do well in your first attempt in the next exam, what will happen is, you will have your internship very easy. You will be learning, you will be always enjoying working in the hospital, because this is what you really wanted to do. So there will be no add-on pressure. You will not be under stress in internship. So that is one thing. So there are like question marks. There are things that, if things don't go well in my first attempt, when will I repeat? There are multiple of those agendas, and I'm sure I've talked about all of them. All the permutations and combinations, I've talked about them in my previous videos. But today I'm here to tell you that do not drown in this chaos of stress and anxiety. You as an individual are valuable. Stop weighing yourself, or stop looking at yourself on the basis of the outcomes. You are not the outcome that yesterday I met a student who said, sir, I did not do well in an exam, so I thought I'm worthless. It is not true. The outcome of the exam does not define who you are. Outcome of any project does not define who you are. Anything that you do, you may win, you may lose. But at the end of the day, you still remain precious, you still remain valuable. And I'm here to tell you, as an elder brother, as your, somebody senior to you, that all of you are precious to all your teachers. We all love you. So please, do not let this stress affect you too much. Please don't panic. We are here to help you, guide you at every step. We will try our best to give you insights on the complex language in every way possible that we can give. But you need to somehow, realign your thoughts, bring some positivity into it. And I have learned only two things in life, and that is what I will tell you at the end of today is, sir, I did not study so far, what to do? Sir, I was not a good student. We keep going back to the past and we keep getting anxiety about the future. Only thing that truly works for me is, I need to close the circle of the past by forgiving yourself for any past mistake. I did not start early. I, got into some longer program. I could not finish it. Whatever happened in the past, I got into a private college. I went abroad. Whatever happened, you can start by forgiving yourself for any past mistake. We forgive everybody. Why not our own selves? And we close the past circle and we live in the present. We start enjoying the process. We detach ourselves from the outcome. Whatever will happen, you will sort it out. You will work out. I am telling you, irrespective of whatever the exams the government might take, you will be one day a massively successful doctor, because you have that compass inside of you, which is pointing towards your why. Remind yourself of your why. Look at future with hope and optimism. Everything will settle down. I am here to help you. I am here to help you settle your nerves. My only purpose is to reassure you that there are changes. I totally agree. There are big changes. I've never seen so many changes happening at such a short pace in medical education. But I am again assuring you the changes have happened in the past, changes will happen in the future. I've seen the NEET exam happen. I've seen the All India and state exams in the past. I've seen a lot of changes happen in my career as an educator. And if I think as an educator that this is the last change, this is happening in the world, it is not true. There will be further changes in the future as well in every sector. So all my request to you is, stay optimistic, look towards future with hope and optimism, forgive yourself for any past mistake, adapt fast, look at the changes as they are, don't look at them with your tinted glasses, look at the changes as they are, adapt fast. If you find it overwhelming, first manage the low hanging fruits, prioritize and realign your priorities. You will find everything will settle down. I wish you all the best. Keep rocking. And once again, I'm telling you, all of you doctors, all of you medical students are already champions. I will end today's talk by telling you, I am rather reminding you that 2 million, 20 lakh school students every year are appearing for their NEET exam. What do they want to become? Can you tell me? 20 lakh students from school with biology are writing the NEET exam. What do they want to become? Tell me in the chat box, what do they want to become? They want to become you. You are a hero. You're already a winner. There's nothing to lose here onwards. You're already a winner. So let's be grateful for what we have achieved so far. That will give you the power of optimism. Look at future with hope and optimism. Don't let the negativity in the world get you, put you into darkness. And I'm here. I am totally reassuring you. I'll work doubly hard. You will see me working doubly hard with the change. Come what may. Whatever we need to do, we will do for you. And you must have seen already in 1 week, we have made massive changes in what we are going to deliver for you. And we will keep evolving. That is my only promise to you as an organization. We'll keep evolving. I wish you all the best. Keep rocking and best wishes.